I invite you to watch this movie. Diabetes is dangerous because it can cause complications such as kidney disease, heart disease, liver disease, cataract, and stroke. Stroke can take place in diabetes, and high blood pressure causes the stroke with or without diabetes. High blood pressure may cause rupture of a blood vessel in the brain, leading to hemorrhage and damage to the various centers in the brain, resulting in a paralytic stroke. Diabetes can also cause nerve pain known as peripheral neuropathy. In this condition, there occurs nerve pain if the blood sugar is allowed to remain high for many years. In diabetes, the healing process is hampered in the presence of high blood sugar level, and therefore healing of wounds and surgical cuts will be delayed in a diabetic. If the blood sugar in a diabetic patient is maintained in the normal range, development of the complications will be delayed indefinitely. He will not develop any complications. A diabetic patient is an easy prey for infections. For example, tuberculosis attacks a diabetic person very easily, and therefore a diabetic should always investigate prolonged fever in the evenings and cough and get regular urine examination done to see if there are changes relating to either diabetic nephropathy or tuberculosis of the kidney. No one need be alarmed with this disease of diabetes because it is a slowly progressive disease. It can only be an embarrassment or inconvenience to those who are mentally determined to face it. A diabetic patient should make mental determination to face it head on. The first inconvenience is that the food has to be altered or reduced. The kind of food that is eaten also has to be changed. A urine test is all that is needed to know if the blood sugar is within normal limits. There is a threshold for sugar in the blood, and it is called the renal threshold. And if this threshold is passed or crossed, then sugar will come in the urine and it will be detected by urine test for sugar, because from the blood excess sugar is passed on through the kidney into the urine, and therefore if there is any amount of sugar in the urine, then it means the level of the blood sugar is higher than the threshold. Now let us study the mechanism by which the renal threshold works. The diagram shows a blood vessel and the kidney. In this diagram there is another blood vessel on the left that takes away the blood from the kidney. Secreted urine goes out through the pipe on the right. In this diagram, blood containing glucose enters the blood vessel and fills the kidney. Glucose is shown as yellow granules in the blood. Renal threshold for glucose is indicated by the green band. Normal fasting blood sugar is below the threshold level. Blood sugar is controlled by insulin so that it remains below the threshold level. In normal people, the sugar level could come up to the renal threshold but does not spill into the urine. In those cases in which the sugar level is high, the excess sugar spills over into the urine. Managing diabetes consists of a number of procedures done at home. One of them is to test the urine at home using these urine sugar test strips. Those who have been having diabetes for more than 5 years can also examine albumin, because albumin is first detected when there is some damage to the kidney. So if there is no albumin in the urine, we can almost be sure that there is no damage to the kidney, produced by the diabetes disease. So, albumin also can be tested at home using dipsticks that are available in the pharmacy. The urine to be tested, preferably, is the early morning urine that we pass after we get out of bed. Blood sugar may be tested according to the advice of the doctor. It is sensible to go to the same doctor all the time for advice. You go to the same doctor so he treats you on a regular basis. And also you go to the same lab for blood and urine tests, etc. so that the differences that come up by using more than one lab for tests can be eliminated or avoided. In the laboratory, the blood sugar test is done using different kinds of machines and methods. One such method is shown here. Your doctor might advise you to get a fasting blood sugar test done as well as a postprandial blood sugar test at 2 hours after food. Blood sugar can be managed at home with a glucometer. The procedure is simple and quite reliable. Lancets are supplied by the company and they can be fixed to the lancet device. Appropriate calibrating strips are given with the machine. Each new package of strips comes with a calibrating strip that has to be used every time to calibrate the machine. The normal range is given on the package. To test, you open a test strip and fix it in the machine. The finger is wiped and it is pricked with the lancet. The finger is pressed and a drop of blood is expressed. Touch it to the end of the strip and let the strip suck the blood. Different makes of machines take different time to show the result. In this machine it's about 30 seconds. The result is 110 milligrams per cent. All over the world, people suffered from diabetes since ancient times. And in India, the disease was known as sweet urine disease. There were different kinds of treatment in those days, and the Indian systems were effective and useful. There were different kinds of diet for diabetes which the doctors prescribed, and some herbal preparations were found useful. Also, there are claims that the Siddha, Unani, Ayurvedic and homeopathic doctors that they have one or other treatment for diabetes. Modern science described the sweet urine disease differently. It was a medical student named Langerhans in 19th century who published that the pancreas is the organ which controlled the course of the disease. The insulin-secreting Langerhans cells in a pancreas are known as the Langerhans cells. Later, another doctor discovered insulin and he published that the disease is curable by using insulin. But not until the syringe was discovered that the insulin extract could be injected into the patient for the treatment of diabetes. Later in the year 1955, as recently as about 50-60 years ago, oral drugs became available for treating diabetes. Now there are a number of drugs which the doctors use to treat the disease. For some patients, insulin is necessary because the oral drugs do not work for them, such as in juvenile type of diabetes, type 1 diabetes. Now it is called type 1 diabetes. Type 2 diabetes appears in older people.